Hello everyone, welcome to my living room. My name is Tim. I'm going to be your nurse practitioner that's going to teach you about hypertension that can lead to organ failure. So let's go ahead and dive into this. Hypertension, what is it? It's high blood pressure that is higher than normal blood pressure, 120/80. It develops over time and has no warning signs, can be a silent killer. Higher blood pressure levels places you at more risk for heart failure, heart disease, kidney disease, and stroke. Okay? High blood pressure can damage your arteries by being less elastic, decreasing the blood flow and oxygen to the heart and organs. Okay? Modifiers of high blood pressure. These are modifiers that you can control and cannot control. So modifiers, non-modifiers are what you cannot control, and that's age and family history. No matter what you do, you cannot control the fact that you're going to get older and that you're going to get genes from your family. Modifiable ones are ones that you can change to prevent you from getting hypertension, and that's a sedentary lifestyle, diet, exercise, stress, and smoking and alcohol. Okay? There's a primary, which means essential, and then there's secondary. That means there's something else going on in the body that's causing hypertension. Could be renal vascular disease, narrowing of the arteries, renin, aldosterone syndrome, and Cushing syndrome. These are just some of the things that can cause hypertension. High blood pressure risks. High blood pressure significantly increases the risk of myocardial infarction, which is a heart attack, stroke, aneurysms and dissections, and dementia over time. Diagnostics or diagnosing hypertension, measuring your blood pressure on one of your arms by using an inflatable cuff. 2 or more elevated blood pressures, your provider tends to start talking to you about hypertension and where you land in that, and whether modifying your diet, your exercise, your stress level, or putting you on medications that could help prevent you from becoming hypertensive. Okay? This is this is an index that shows normal, elevated, high blood pressure stage 2, and then hypertensive crisis, which means really important. Regular blood pressure is anything under 120/29. That's more elevated, so if it gets greater than 130, then it goes from there. But normal blood pressure is less than 120 and less than 80 on your diastolic. Hypertensive emergency. If you are hypertensive, that means your blood pressure is greater than 180/120. Means you're in a critical stage. Presence of organ damage is present. You need to call 911 immediately. The presence of organ failure is heart, chest pain, shortness of breath. Kidney could have some blood in your urine. Brain could be severe headaches and confusion. Vessels, you start to develop aneurysms in your vessels. Complications that lead to hypertension is coronary artery disease, atherosclerosis, or your vessels start breaking down like aneurysms, stroke, heart attack, kidney disease, diabetes, peripheral artery disease, and adrenal disease. These are all complications from hypertension. Prevention of hypertension, well, keep a healthy diet, consume a healthy diet. Keep a healthy weight, consume a healthy diet, cut down on salt, exercise, being physically active, limit alcohol, stop smoking, and try to get plenty of sleep. Those are all benefits to keep you from being hypertensive. Medications, when we start to treat, sometimes your blood pressure starts to get elevated, and even though diet and exercise, stress levels are all controlled, you may need some medications like angiotensin converting enzymes, ACE inhibitors. These are called like lisinopril. Angiotensin receptor blockers, these are losartan. Calcium channel blockers, they help, and that's amlodipine, and diuretics. certain meds like Lasix can help lower your blood pressure, keeping you within normal limits. When to go to the hospital, this is the most important thing. Chest pain, shortness of breath, back pain that's not going away, difficult speaking. These are more symptoms of like stroke, dizziness, vomiting, and numbness and tingling in the face and extremities. Okay? The only way you know your blood pressure and the risk factors is to take your blood pressure with a manual blood pressure cuff. So I'm going to go ahead and demonstrate on my table here is a blood pressure machine, and I'm going to demonstrate for you how to take a blood pressure. So I'm going to come over here, I'm going to sit down, I'm going to relax. I'm going to go ahead and apply the blood pressure cuff. Where the cuff is, that's where you want to put right here in the AC area of your arm. Okay. It's a lot easier when somebody helps you, but I'm demonstrating today. I want to go ahead and turn this machine on. I want to relax for a minute. Your back up, your arms relaxed, feet on the floor. Take deep breaths, slow. My blood pressure is 122/72. Okay? That's how we check a blood pressure. Taking your blood pressure daily, sometimes 2 or 3 times a day, will help you know what your numbers are. So that way when you go into the doctor's office, you can let him know what your pressures are. You can write them down on a log, and you can keep track of when your blood pressure starts to go up, when your blood pressure is down, and you can monitor it from that point. Thank you so very much. My name is Tim, and I hope you have a blessed day.